Thank you, Poonamji, and thank you, Hindi team and Sahani sir. Now we are moving to English session. Today is our 1549th day of continuous webinar. Thank you all the participants for joining with us. So before beginning the session, we will have a silent prayer. Good evening once again, all the participants. Now it is the time for our English session. As I told you, today is our 1549th day of continuous webinar. Thank you all the faculties. You are sharing your knowledge here. Our purpose of IFPH is to unite the homeopathic doctors together across the globe and share the knowledge to each others. So today we got HEENA RAWAL. She's MD Homeopathy. Dr. HEENA RAWAL. She's MD Homeopathy. She's academic director and in Ahmedabad campus, Parul University, HOD, professor, PG teacher and guide. In the Department of Organon and Philosophy, she has 37 years of experience. She is a PhD guide and National Assessment and Accreditation Council chairperson, NAHB principal assessor, and paper presented in many seminars and speaker in many seminars and many associations and paper published and member of many research studies and chairperson of many research studies, and actually many more I have to say about her, but now I am inviting Dr. HEENA RAWAL for taking class. You're welcome, madam. You're welcome, please.
Thank you so much. Thank you so much for this lovely introduction. Thank you, ma'am. First of all, I would like to thank Dr. Sahani sir for again inviting me to this marathon webinars, I would say, because before so many months I had appeared, and again today I'm coming. So it is a commendable job which Dr. Sahani sir has started of having so many webinars in a row. And by this, all homeopaths all over the world are encouraged and they are motivated by your efforts, sir. So, pranam, sir.
One thing is great for you that you are promoting our webinar. You have been sending many of the speakers. So, thank you, madam, for your this supports.
Thank you so much, sir. Thank you so much. Thank you, sir. Sir, our staff is getting an opportunity to present webinars because, sir, you are even inviting the junior staff. So, sir, I am also glad about it that the second generation is getting exposure by your efforts, sir. I hope my screen is visible.
Yeah, yes. It is visible, ma'am.
Yeah. Okay, sir. Okay, so today is my topic about the paucity of symptoms. Now, see, we homeopaths in our practice, all of those who are there, the senior homeopaths, I greet all of you, and all of us have practiced in our practice. We have experienced that many a times we get a maze of symptoms. The patient keeps on telling symptoms for everything what we are asking, and many a times it happens that the patient, we are not getting enough symptoms. The patient comes with only one complaint, and then the patient is not able to tell anything else about it. They don't understand sometimes homeopathy, and therefore they are not ready to answer, or sometimes there are no symptoms and so they are not able to tell us. So all those who are practicing homeopathy have faced this problem of not getting enough symptoms so that we can form the totality of symptoms, and on that totality of symptoms we can select the simillimum. Now, first I'll go to our source books, and from the source books what we have learned, and it has been very helpful in my practice also, that whenever I have gone to the source book or I have followed the Organon of Medicine written by our master Dr. Hahnemann, and if I've applied whatever is written in my practice, it is always beneficial. So going back, the complaints where we are getting paucity of symptoms or lacking of symptoms, in the Hahnemannian classification, or what we call the clinical classification of diseases, in our very own textbook, that is the Organon of Medicine, the Bible of homeopathy, Hahnemann has classified the chronic diseases with fully developed symptoms and with few developed symptoms. So see, there only Dr. Hahnemann himself must have faced these conditions where he was not getting enough symptoms. So right from there, it starts that there are some diseases, chronic diseases, though they are chronic, but they have got very few symptoms. And those diseases, Hahnemann sir said that they are the one-sided diseases. And in those one-sided disease, again, sub-classification is that either the symptoms are on the mental plane or only on the physical plane. So say only on the physical plane, the patient comes with only one symptom, that I've got headache. Nothing else. He is not able to tell anything. How you feel better, how it is increasing, how it is decreasing, no idea. At what time you are getting the headache, sometimes it is in the afternoon, sometimes it is late in the evening. So see, this patient keeps on giving you vague symptoms, and he is just telling you that I've got headache. So these are the symptoms where the one-sided diseases, where the symptoms are only on the physical plane. And then there is another thing, that the patient may say that I've got a phobia, I've got a fear of darkness. Now, how that started, what happened, since how long you are having, I don't remember. I don't remember since how long I'm having. I don't remember at what places exactly I'm having. But if there is darkness, if the room is dark, I can't enter. Now, see, this is a symptom which is on a mental plane. And this adult patient is giving you, like say for example, if a 5-year 6-year child is saying that he is not able to enter a dark room, then it is not at all a symptom. But say if an adult patient is saying this, then of course it is a symptom. So one-sided diseases with symptoms either on the mental plane or on the physical plane are the diseases where you are not able to get enough symptoms. Now, see, commonly all of you must have seen that in our practice, we, and even some of the physicians, because see, I am attached to a college and we have got UG, PG, and PhD scholars also. And most of the PG students, they are sitting in the OPDs. And many a times when they do the case taking and when they come to us, we realize that not only the patient, but the doctors also generalize the disease. What is the disease? Then the students will come and say that the patient is having headache. It is the generalization. It is a very, very vague term, that the patient is having headache. Now, this actually is a symptom which they consider it as a disease. And so even the patient will say that I am having headache. The doctors will also describe it in the same way. So in my experience as a teacher, I have seen that not only the patients but also the physicians are using a very vague term for explaining the symptoms. Then, as we have studied in Organon, right from the third aphorism, Dr. Hahnemann says that the physician has to perceive what is to be cured. So we are not going to, in the previous speaker, Dr. Poonam was also saying that we have to have a holistic approach. We are not going to treat only the symptom of the patient or the name of the disease. It is, we are going to treat the person as a whole. We are going to treat the individual and not the disease, because disease is something which has happened to the individual. The vital force is deranged, and as a whole, the person is suffering. So you can't generalize the person, because whatever is happening to the person generally is exhibited locally in a small part, and whatever is exhibited locally is affecting the person as a whole or is affecting generally. So to treat the individuals, we require the entire picture, the totality of symptoms. So we require that skill, that art, that how to perceive the case and how to get more and more symptoms, though it seems that like it is just a paucity of symptoms. But when we probe into the disease, when we probe into the patient, when we ask skillfully questions, then that paucity can be converted into a very useful totality of symptoms. So that is one thing. Now, as I said, that in your case perceiving, I always tell the students, it is not case taking, it is perception. And therefore, in the third aphorism, it is written that you have to perceive what is to be cured. So, in your case perceiving, you have to be very vigilant. Sometimes something which is very unique, very individualizing, may come from the words of the patient, may come from the actions of the patient, how the patient is acting in your clinic, or whatever he is doing in your clinic. You have to be very observant. What is written in Organon, the sixth aphorism, you have to be a keen, unprejudiced observer. Sometimes the posture of the patient, because you see in the materia medica, there are medicines where the postures are described, the behavior, say, especially of a young child or even of any other patient. The patient is very restless, the patient is very calm, the patient cannot recollect the words. So his speech, his expressions, his facial expressions, the gestures which he is using in your clinic. So see, this is again another topic, that you have to be very, very vigilant in your case taking, because sometimes the cases where it seems that there is a paucity, you may find out something from the actions, the words, the postures, the behavior, or the gestures of the patient. Something individualizing, something peculiar may come out, and which may help you very much in the selection of your medicine. So that is what is very important in case perceiving. Now see, as I told you, we'll go to our book, our Organon, and there it has very specifically, Dr. Hahnemann has written that the symptoms, it is written in aphorism 153, that the symptoms, even you are getting one symptom, which is striking, which is singular, which is uncommon, which is peculiar, what we call PQRS, peculiar, queer, rare, strange. So even if one symptom you get, which is a PQRS, which is something very, very peculiar, then it is enough for you to select your simillimum. Because in the materia medica, there will be hardly one or two drugs with that PQRS symptoms. And so it becomes very easy for you to find out the medicine. See, recently I had a patient just yesterday where the patient had gone to some Ayurvedic clinics, and for some disease condition, like it was migraine, and where the patient was advised leech application. In the introductory part of Organon, Dr. Hahnemann had described some of the inhuman methods in which he had mentioned a leech application. Now, this leech application is still used in Ayurvedic science. So that is, they say that there is the impurity of the blood and it has to be removed. And so leech application is done. And the leech sucks the blood, and they believe that the cure takes place. Now, this patient who came to me, a lady, she said that she was having this leech application. But after that, the skin around that place where the leech application was done had blackened. There was a black discoloration and it had become very black, and even I saw it. There was a big black patch. And she said that I asked for the itching. She said that no, I don't have itching over there. And then I was not able to first decide. Now, see, this is a paucity of symptoms. You are getting only one symptom, that there is a blackish discoloration after leech application. I asked about itching. The patient said that I'm not having in any itching, some oozing or some blood coming out. She said, no, nothing. Only this black spot has come, and I feel it is a cosmetic, like cosmetically the patient doesn't feel good, and so the patient wanted that to be removed as early as possible. Now I opened the repertory, I used the Fatak repertory, and there I saw that for insect bite, the discoloration after insect bite. So in that, there were two medicines, but the medicine without itching was Sequel Core. So I have given sickle cord to the patient. Still, I don't know about the result because it was just 2 days back. But see, this is what I'm trying to say, that even one symptom, and if it is peculiar, then you can go to the materia medica and you can find out medicine, and there will be only few medicines, and so your selection becomes easier for that. So this is what is important. We follow the 153rd aphorism of Organon whenever we come across paucity of symptoms. That is to be remembered by all homeopaths. Now see here again, not only Dr. Hahnemann, we'll come to all the aphorisms later on, where Dr. Hahnemann has instructed how to manage the patients with paucity of symptoms. But not only Dr. Hahnemann, the ardent follower of Dr. Hahnemann, Dr. Boning Hussain, he has also told us that how to individualize your patient on seven different aspects. When there is a paucity, this is he has given for individualization. These are the points given by Boning Hussain for individualization. But in practice, I have seen that if you are not getting enough symptoms and it is difficult for you to find out the simillimum, then you can use any of this. So these are the seven points. All of us know the quis, quid, ubi, cubis, auxilis, cur, cumando, and cuando. So this is what we teach our students also. But these are the important points. So one by one, let us see that how we can find out the medicine on these points also. Now see, this quiz is a very, very important point. Why I say important point? Because in Organon, if you read different aphorisms, Dr. Hahnemann has repeatedly mentioned that the change in personality of the temperament of a patient is the disease symptoms. See, many places it is mentioned. What is important, like say, for example, the patient is very quiet, very silent. He is not very talkative. He doesn't like to talk much right from childhood. The patient is an introvert, very silent, not talking much right from childhood. And say when he comes to you, the patient is not talking much. The patient is remaining very silent. And when you are asking the relatives or the attendant of the patient or even the patient, then they say that he is a very introvert person. He hardly talks. Even when there are so many people in the room, he'll respond only what is asked to him. Now, if that same condition is there, then as your rubric, you don't take the thing introvert or talking less, because see, that was the patient's personality right from the beginning. But say a person who was very cheerful, who was very talkative, who was an extrovert, and now he has become an introvert. The attendant of the patient also says that I don't like to talk now to anybody. Previously I was a very talkative person. Or even the attendant of the patient says that now hardly he speaks, otherwise he was non-stop, he was talking. Now see, this is a condition which is to be considered. This will become your rubric. This will become your symptom. So change in the personality, change in the temperament, then becomes very sensitive to the reactions, to the stimuli. Previously, the patient who was saying that I was very tough, very hard. Now even a change of weather or some autumnal dysentery I get, or some snuffles I keep on getting again and again. So these are the things which are very important, which you should understand. Disposition, again, a very important point. In the footnote also, Dr. Hahnemann has written that the person's disposition, that is the entire personality, the constitution, the temperament of that person, the disposition is to be taken into consideration. If the disposition was mild and still it is mild, then it is not an important symptom for us. But the disposition was mild and yielding, and now the person has become very aggressive, then that is to be considered for a homeopath. So he has written very, very, very specifically for the medicines also in Organon, that aconite will seldom affect rapid cure in patient of calm disposition. See, aconite must be restless. But if the patient is a very calm person, and if you think of giving aconite to that person, then it is not going to work. So many examples. He has written the example of pulsatilla. He has written the example of nux vomica, ignatia. So pulsatilla, there should be yielding disposition. But if the patient is very obstinate, not yielding at all, then don't think of giving pulsatilla. So just like in our case taking, in our materia medica also the dispositions are given much importance, and according to the disposition of the patient, according to the whole personality of the patient, we select the medicines. Then quiz is again the whole personality of the person, so it comes to the likes and dislikes also. Now we all homeopaths know that somebody's likes may be somebody's dislikes, somebody's dislikes may be the vice versa. So these are the individualizing factors. So for when there is a paucity of symptoms, you do your individualization on such factors also. You consider the likes and dislikes, and so from the materia medica, you can match the medicine. And of course, the mental general symptoms, according to the Kent's gradation. Mental general symptoms are the symptoms which are presenting the person as a whole. They are the symptoms which are affecting all the emotions. It can be happiness, it can be grief, it can be sorrow, it can be injustice, all these. So see, Dr. Kent has given it the first grade. It is the first grade symptoms. So if you are getting only one symptom, one physical symptom, then try to probe the patient and try to find out symptoms which are the mental general symptoms, that after this headache has started, how your personality has changed, how your sensitivity to various stimuli have changed. So then you can reach to the similar. See, these are the different points that when there is paucity, what you will look for to manage your patient. Then quid. Now see, this was the previous one was the individualization of your patient. In the same way, that individualization of the disease is also important. And for that, when you are forming the totality of the symptoms, then you don't do the selection on the pathognomic symptoms, but you do the selection on the non-pathognomic symptoms. Pathognomic symptoms means the symptoms which are common to the disease. Like say, for example, if a person is suffering from pneumonia, then there can be cough, rusty sputum, there can be fever, pain in the chest. Now see, these are all pathognomic symptoms. But say with whooping cough, it resulting into a vomit, with a clean tongue, see what, this is what we take. And so we can think of our medicine. Whooping cough with a sound like as if the sand parchment paper is rubbed against one another, we can go to the medicine. So these are the medicines where the symptoms which are I'm talking from the materia medica. So how to make a common symptom uncommon? Again, it is the skill of a homeopath. So if you want to manage patients with paucity of symptoms, then you have to learn that these are the common symptoms. And see, that is the reason we study practice of medicine, we study pathology. So we know the common symptoms. If we know the common symptoms, we will learn how to make them uncommon. So whatever symptoms, if you are getting vague symptoms, try to find out something by which that symptoms can become your prescribing totality. UB, that is the seat of the disease. That is the exact location of the disease. Now see, sometimes the location is also very important. If you go to Materia Medica, Dr. Nash, Materia Medica, say for gaseous distension, there is a trio of gastric complaints or gaseous distension. Now, if it is upper abdomen, then we say it is carbovage. If it is lower abdomen, then lycopodium is indicated. If it is the entire abdomen, then there is China is indicated. So now see, this is just an example, but the location also plays a very vital role in your selection. See, you are getting a paucity of symptoms, but say if the patient is saying that I am having gaseous distension only in the lower abdomen, nothing, no more symptoms the patient is giving you. So you may, when you are not getting enough symptoms, then you may start with the, say, lycopodium. So this is sometimes, it may be when the symptoms are very vague, you are not getting enough symptoms, then you can think about such things that which will help you in selecting your medicines. Then sometimes what it may happen that according to the location, the modalities and sensations may also change. So that may also become an individualizing factor and may help you in selecting your medicine. Like say, for example, that in arsenic alb, all the complaints of the body are aggravated by heat application. Now see, this is a entire body, the location, as well as the modality. So sometimes you can ask questions in that way also, or the patient may give you such location along with the modality, which will help you in selecting the medicine, that all the symptoms of the body are aggravated by heat application except the head. Arsenic, they'll say except the head. So see, it helps you in the selection when there is a paucity of symptoms. Or in silesia, there is a fishbone like sensation only during the throat complaints. When the patient is having throat complaints, then there is a sensation as if there is a fishbone. So sometimes these locations can be helpful. Then the side of the body, of course, we know the right-sided and the left-sided medicines. Lekes is very famous that it is the left-sided remedy. All the symptoms which are moving from left to right, lycopodium, the right-sided medicine, then something which is related to the side of the body. So many such pulsatilla, no, the shifting pains are there. There is no side. The pains are sometimes here, sometimes it is there. So in abrotenum, there is marasmus, which is ascending in the body. It is going from below to upwards. So different types of side of the body also, when there is paucity, you can use it for your selection. Then medicines have affinity, as I gave you so many examples. Along with the location comes the extension also, that how the pains are extending, like say the patient is saying only about migraine, then migraine from the middle of the head going to the back of the nape of the neck, or going behind the ear. So such extensions can help you in selection. And most important, the seat of the disease will help you in making your symptoms complete. Complete as in sensations, locations, extensions, modalities, and concomitants. So that is a complete symptom. When we'll come to the organon part, the Dr. Hahnemann's organon part, we will see that Dr. Hahnemann has written that even if you get one complete symptom, then that one complete symptom can become your totality of symptoms, and it is enough for the selection. So complete symptom means there is a sensation, there is a location. If at all there is an extension, then extension. And there is if at all there is a concomitant, then and the modalities. This is enough for selection of your similibum. So to make the complete symptoms, the location is very important. Now, Dr. Morning Hussain gave prime importance to the concomitant symptoms. And we in our practice as also, we have seen that these are the symptoms which are always very individualizing. Why? Because they exist with the chief complaint, but they have no logical connection with the chief complaint. And therefore, they are very individualizing. They are in themselves something which is peculiar. They in themselves is something which is belonging to that patient only. It is for that patient only. It is not one person's concomitant is not found in another person. So in itself, it is something which is very important. And therefore, many stalwarts of homeopathy have given very much importance to these concomitant symptoms, because they are atypical, they are not related, and they are different from person to person. And thus they become very individualizing. When you find in your patient, it is always individualizing, and it becomes very easy for selecting the medicine. And in the materia medica also, there is a connection of these concomitant symptoms, and some of the medicines, the concomitant symptoms are already written, which are very important. Like say, for example, in antimtard, there is great sleepiness, irresistible inclination to sleep with all complaints. Now, see, this is something which is very individual. Any complaint, it may be a complaint of cough and cold, the rattling in the chest, and here there is a irresistible desire to sleep. So it is something which is very this thing individualizing. Same way, if you see in gelsemium, trembling, drowsiness, dizziness is associated with many complaints of gelsemium. So it becomes very important for us to select a medicine and to match the medicine and to find out the similimum. Then the next is, this is same about concomitant, that they bear a distinctive mark of many of the drugs. As I said about gelsemium, they are sometimes misunderstood as a complication of the disease by the non-homeopaths. They think that this is another symptom or something new disease has started, and they are enough to form the totality of symptoms. Even if you get Hahnemann, Dr. Hahnemann has also written that even if you get one such peculiar symptoms, then it is enough for you to select the medicine. Now, the root cause, the fundamental cause, as mentioned in aphorism 5, the prima causa morbi, more or less it is mentioned for sora, that there is a latent sora and which is acting as an obstacle and which is not allowing the cure to take place. So it is the main cause, the mother of all chronic diseases, or it can be any other miasms also. So when the miasm is not allowing the cure to take place, so we usually, what we are doing in our second prescription, that we are using the anti-miasmatic medicines as a intercurrent medicine, right? So when there is a miasmatic block and the cure is not taking place, then it becomes important that you have given a medicine and there is a paucity of symptoms, you have given a medicine, you feel that it is more or less similar, but still if cure doesn't take place, then as mentioned, even in Organon, this is mentioned in Organon also, you may try a anti-miasmatic according to the symptoms of your patient. Many more or less, Dr. Hahnemann has written that it may be antisoric, but sometimes it can be antisyphilitic and antipsychotic. But you can try a miasmatic medicine so as to remove that miasmatic block as an intercurrent medicine and to see that the obstacle is removed. When the obstacle is removed, then even with the paucity of symptoms, the cure can take place. Then the time factor. Now see, again, a very important factor, which is always very individualizing. Because we have seen in our materia medica also, the very what we teach our students, and all of us also know that arsenic, the 10 to 12 and 12 to 2 a.m. and p.m. midnight, midday aggravation. Then in Kali group, there is early morning, that is 1 a.m. to 3 a.m. aggravations, lycopodium 4 to 8 p.m. So colocynth 4 to 9 p.m. So there are so many different medicines also where the time modality is mentioned in materia medica, as well as this time modality again is important because it differs from person to person. No two people, no two patients may be having the same type of time modality. So the aggravations, the ameliorations, the sometimes when exactly the symptoms, all the say as soon as the head touches the pillow, the coughing starts. So at night the coughing is there. The itching is at the night, or the season also, the periodicity of the symptoms. In Organon, there is an entire so many aphorisms for intermittent diseases, intermittent fevers. So the particular period or the particular time when the disease is coming. So when there is a paucity of symptoms, you can go into the detail and try to ask about the aggravations, ameliorations, appearance of the symptoms at what particular time, or you can go for the periodicity. Like say, for example, very peculiar periodicity you find in sanguinaria, where the headache is appearing on every 7th day. Now, see, this is something which is very, very peculiar. And in your patient, you are getting one symptom, but this peculiarity is found, then it is very, very, very going to be very useful. Petroleum, again, a medicine which is indicated for all winter complaints. So it has got an affinity for the winter season. So when you get such peculiarity, even if there is less symptoms, the cure can be achieved. Then, of course, as I said, modalities, the aggravating and the ameliorating factors by which the intensity of the symptoms increases or decreases, they are always individualizing, they are always unique. Why? Because same one person's aggravation can be another patient's amelioration and vice versa. The aggravating and one person is feeling very good in open air, another person wants all the windows to be closed, cannot tolerate open air. So see, there are so many, means there are, as homeopaths we all know that there are so many such examples that the modalities may differ from one person to another person. Even Dr. Hahnemann has written that if the modalities do not match, then always think that the medicine is negatively indicated. There are all chances that the medicine which you have selected may fail. And this is we have, means, I don't know, some of you must have experienced in your practice also, that the chief complaint we feel that this chief complaint is indicating this medicine, but say the modalities are not matching, and if you have tried that medicine many a times, there are chances that the complete cure or the permanent cure is not possible. We may not follow the second aphorism of Organon. So when you don't match your modalities, then there are chances that the medicines may be negatively indicated. And so there are all chances when the modalities are not matched properly. Again, the modalities are also sometimes very individualizing, very peculiar also. The modalities of Ignatia, some of the modalities of pulsatilla, these, because I'll go into materia medica. So, but the modalities, if you go to the materia medica, you find that there are so peculiar modalities, and some of there are so much indicated that even by when the patient speaks to you, when he starts saying about the modality, the medicine comes to your mind that this is the medicine which can be used. So we can we can find out the medicine by matching the modalities of the patient. And again, it is very important to make the complete symptom. As I said, that even if one symptom you are getting complete, then it is enough for making your totality of symptoms. So you can make a complete symptom by your modality. Now we come to the instructions which are given by Dr. Hahnemann in Organon, that how will you manage patients which are one-sided or which are having scarcity of symptoms. The symptoms are less. Now, according to these instructions, as I have written over here, Dr. Hahnemann has given, like from aphorism 162 to aphorism 170, he has given the instructions that how will you select a medicine when there is a paucity. Now, the instructions which are given, in that first Dr. Hahnemann says that sometimes it is not the paucity that the patient is not giving you enough symptom, but it is a paucity in the materia medica. That symptom, now see, this was, Organon was written, as we know, way back. So at that time, this aphorism, that is aphorism 162, which says that there is a paucity in materia medica, at that time it was applicable. But I feel now it is not applicable because there are so many medicines which have proved after that, also after Dr. Hahnemann and after Dr. Hahnemann wrote in Organon, there are many, many more medicines added to materia medica. And so paucity in materia medica is nowadays not applicable. So we come to the 163rd aphorism, where Dr. Hahnemann says that if there is a paucity of symptoms, and say you are not able to get the symptoms after repeated case taking or probing case taking, First, he writes that if you do a probing case taking, if you observe your patient properly, if you try to perceive your patient properly, then asking questions in a proper way, framing the questions in a right way, then you are going to get enough symptoms. But still there is a paucity. Then Dr. Hahnemann says that you can select a partially similar medicine. This is the instructions which are given by the master. So you select a medicine which is not completely similar, which doesn't matches all the symptoms of the patient, but say few symptoms of the patient, and you give that medicine. Now, after administration of that medicine, it may so happen that some of the symptoms of the patient may be removed, but some symptoms may still remain. And to those symptoms, as the medicine is partially similar medicine, so it may happen that the medicine may produce its own symptom, which are known as accessory symptoms of the medicine, right? Accessory symptoms of medicine. Now, in the chapters, in the aphorisms of case taking, he has mentioned accessory symptoms of the disease. Here he is writing about the accessory symptoms of the medicine. As you know, the accessory symptoms of the disease are also very peculiar. They are very important in your case taking. Why? Because these are the symptoms from which the patient is suffering from such a long time that the patient feels that this is the part of their day-to-day rituals or the part of their constitution. They do not think they are abnormal. Like every day in the morning while brushing the teeth, he has a sour vomiting. Now, this is happening for so many years, and the patient feels that it is something which is very normal. So these he has mentioned in accessory symptoms of disease, and he says that this can become very important for selection of the medicine. But here he is talking about the accessory symptoms of the medicine. When you have given a partially similar medicine, then the partially similar medicine will remove few of the symptoms. Few symptoms of the original disease will remain, to which the accessory symptoms of the medicine which are produced because the medicine was not a similimum and may get added. Now, if you have given your medicine in a very small dose, then it may happen that gradually the accessory symptoms of the medicine may fade off. It may go away. So you don't need to do anything. Again, the symptoms, now hear what he says, that in your selection, you have given a partially similar medicine, but say the partially similar medicine matches the singular, striking, peculiar symptoms of your patient, peculiar, queer, rare symptoms of your patient, strange symptoms of your patient. And you have given on that peculiar symptom, you have given a medicine, then the cure will take place. As I gave you so many examples that some of the modalities are peculiar, some of the symptoms are peculiar, some of the sensations are peculiar. So if you have given the partially similar medicine on the PQRS and not the other symptoms, you have selected only one uncommon symptom or PQRS symptoms or the non-pathognomic symptom, then cure will take place. So you don't have to do further exercises. As I said previously, that if your symptom is complete, it has got sensation, it has got location, it has got location with extension, if any, it has got modalities, then, and if at all there is a concomitant, so if a complete symptom is there and you have selected the medicine on the complete symptom, then again the partially similar medicine will be able to produce the cure. Now, if the medicine is selected on the common symptoms, that is the pathognomic symptoms, or the selection is done on an incomplete symptom, not the complete one, but incomplete symptoms, then there will not be cure. Then, as I said previously also, in aphorism 166, Dr. Hahnemann writes that the paucity of drug proving is rare, and so to find the similimum is easy. Now, see, before so many years, he said that the paucity in materia medica is very less. Now it is almost negligible because so many more medicines have been added after Dr. Hahnemann wrote Organon. So if the partially similar medicine is on the uncommon symptoms or on the complete symptoms, then cure will take place. But say if it is selected, you are not getting any PQRS, you are not getting a common symptom, and a selection is done, then what will happen, that especially in acute disease, sometimes accessory symptoms of the medicines which have appeared may be some violent symptoms also, maybe some more aggravated symptoms from what the patient was already suffering from. So then what you have to do is do a re-case taking. Like first you have done a case taking, you have selected a partially similar medicine, and the cure has not taken place because the selection was not on the non-pathognomic or on the complete symptom. So cure has not taken place. So what you do again, that you do the re-case taking. In that re-case taking, the residual symptoms and the accessory symptoms of the medicine, you form a totality of symptoms on that. And if possible, now if possible, you are able to find a similar medicine or a homeopathical medicine because now the symptoms are more with you, then you can find out that homeopathical medicine or similimum and the cure will take place. But say again, your partially similar medicine fails, then again what is left out, the residual symptoms as well as the accessory symptoms of the medicine, again do a recase taking, again try to find out a medicine. And so by this trial and error method, in paucity of cases, you can cure your patient. The condition being if the patient continues to come to you, that you are doing recase taking, selecting a medicine, so it is taking time also, but in written in organon that you can use, you can keep on doing such recase taking till the restoration of health takes place. Now say when you are giving the partially similar medicine as mentioned in aphorism 169, that it may happen that during that time one medicine is matching partially, the other set of symptoms another medicine is matching. So in your mind, there is two things which are going on. That out of these two medicines, which medicines can be given? Now, at that time, as I was talking about the case of sickle core, there was petroleum also, but the patient was not having itching. So both medicines were not covering all the symptoms, only one symptom. But according to your experience, according to your knowledge, you try to realize, you try to find out that out of these two medicines, which is indicated more. And so you can use that medicine. Now here Dr. Hahnemann has given a caution that you are using one medicine when you feel that there are two medicines which are partially indicated. Out of that, you feel that this may be more likely, looking to the patient or talking to the patient, you feel that this medicine is more likely. You give that medicine and say cure doesn't take place, then what he tells you, what is the caution? That don't give the medicine of your the second choice medicine. Because now, because you have given the first choice medicine, the totality of symptom must have changed. Some of the symptoms might have gone away. So the second choice medicine may now no more be indicated. So here he gives a caution that you just do again a case taking, try to form the totality of symptoms and try to see that whether the second choice medicine is still indicated. If it is not indicated, another medicine is indicated, it may be a partially similar medicine, then use that medicine. But again, he says that sometimes it may happen that the same second choice medicine is still indicated. So you can use it. So second choice medicine may be still indicated and you can use it. Now this point is very important, which I have also tried, that if there is a paucity of symptoms and you are not getting enough symptoms, then use low potency of opium. And by using this low potency of opium, sometimes symptoms may come out. Because see, we go back to the aphorisms of primary action and secondary action. opium's primary action is to subdue, to suppress, to bring numbness. But in the secondary action, the primary and the secondary action are competent to one another. So in the secondary action, what will happen, that the amount of numbness which is produced, the same activeness is produced. So sometimes the symptoms which are suppressed or subdued with low potencies of opium, those symptoms may come out, and it would become very easy for you. You may get a complete totality of symptoms, you can get a complete disease picture, and the selection of the medicine becomes very easy for you. So this is a final caution, this is a final tip which is given by Dr. Hahnemann in treating the diseases where there is paucity, or patient where there is paucity. Now here he says that if they are non-venereal chronic diseases, that is psoric, when there is psora which is underlying, then you can use several antipsoric medicines may be required. Say one antipsoric, there is a paucity of symptoms. The symptom which you are getting is, say, indication of psora. You may give one. Now this is, if we have to study miasms, like it is another interesting topic. Like as we say the peeling of the onion. So when we are treating miasms, sometimes on the surface, it is that iceberg phenomenon, that on the surface, there are very mild symptoms which are seen. But if you give the medicine, then some other symptoms may come up, they come up. So repeated use of antipsoric medicines can produce permanent cure when the patient is having a paucity, but the complaint is since a very long time. Say examples of, say, migraine or some rhinitis or bronchitis. These are complaints which are there for a very, very long period of time. And by giving repeated antipsoric medicines, we can bring permanent cure to the patient. But again, the same caution Dr. Hahnemann has given over here, that you have given one antipsoric medicine, and say now the symptoms, the picture of the disease has changed. So after the previous antipsoric medicine, for the residual symptoms, you may have to choose another antipsoric medicine. The same may not be indicated also. Now see, if you go to local diseases, if you go to mental diseases, everywhere Dr. Hahnemann has mentioned that if the cure is not taking place, even if you feel that the rightly selected medicine is given, the cure is not taking place, then always consider psora as an obstacle which is not allowing the cure to take place, and think about giving an antipsoric medicine. And that when that miasmatic block is removed, then the cure may take place. Now see, these are the instructions which are given in Organon. For chronic diseases, Dr. Hahnemann has said that they are usually psoric in nature. Keen, you should be a keen observer. Sixth aphorism, painstaking, probing, extensive case perceiving is the key in paucity of symptoms. These are the points. This is the skill of the physician by which he can find out the striking, singular and peculiar and complete symptoms of the patient. And so the paucity of symptoms, the diseases can be managed. These are some of the examples which I've already mentioned. Some I've mentioned: the sore, lame, bruised feeling of arnica, which can be a keynote. Profuse acrid leukorrhea running down the hill, alumina is indicated. All complaints started after suppression of skin disease, sulfur as an antipsoric. All complaints started after a fall or an injury. There is a past history of an injury way back, then you can think of giving one dose of arnica. So successive recase taking and re-administration, the cure is possible. So this is what is the instructions which are given in Organon, and by which we are able to manage our patients by the use of the aphorisms. Now see, these are some of the cases which we have experienced, which I have experienced, as well as I have taken some of the cases from some stalwarts also. So there is a child who was 1 year old and who had come from frequent gastric trouble. And during the case taking, nothing uncommon was found. It was the simple, there was a distension of the abdomen, crying, and in the crying also there was nothing such a peculiar thing. But while I was asking the mother in detail about the food choices of the child, she told me a very unique thing, that the child would eat food and drink which is very, very hot. Even if it gets little cold, the child would refuse having it. As for example, if the child wants milk and the mother brings it from the kitchen to his room, only in that much time, the little cold the milk would become, the child would refuse straight away. Now see, this is something which is peculiar, which I was telling, singular, peculiar, something which is very, very rare. On this information, the rubric desire for hot food plus plus was taken, and lycopodium was prescribed, and the child was much better with 1 dose only. So this is, see sir, this is whereas paucity, only one symptom can be enough, for one modality or one like, one desire can be enough for your selection. Then there was a lady who, this was a patient 1 year back. In one lady used to have frequent complaints of dry coughing on and off since 2 months. No particular aggravating or ameliorating factors were found out. On the mental plane also, the lady was completely fine. She was given frequently used medicines for dry cough like Drosera and Brania, but nothing was working out for her. On re-case taking, we tried to find out the causative factor, which always guides for the right prescription. See, this is very important, to go to the cause, how it started, when it started. On asking in detail, she revealed that she had taken Covishield vaccination a day before she started having this complaint. On that basis, rubric bad effects of vaccination was taken. Looking at her constitution and on the ailments from, Thuja was given and she was cured within 2 days. The coughing stopped. And this was just like a miracle. And this was just, she said that after I took the vaccine, this has started. So she was like fearing that she is having some chronic corona. That was her feeling. Now, this is a case which is from Dr. Kent. Here is Dr. Kent's peculiar case.
Excuse me, doctor.
Yeah.
We have 3 minutes more. So
Okay.
please continue.
Okay, so this is a case of Dr. Kent, so I can skip this case. This is again a case which was cured by sickle core. But see, on there are a few cases which are from this thing. But here I would like to say one case in the last, this which I've read, I have not mentioned it. It is from Dr. K.N. Mathur, Principles of Prescribing, and where the Kent's repertory was used. Now, this was a very interesting case where there were two friends, and they were like everyday evening meeting for playing cards. Now, one Sunday evening, they were very close friends and they met for playing the cards, and they like were going for morning walks also together. So the other friend told, the other friend was a priest, and the priest told his friend that tomorrow morning we'll go for a walk. So he said, okay, at 7:30 we meet at your place. Then next day 7:30 that man did not arrive. So the priest was very much irritated. He waited for 10-15 minutes, and after that he called that friend's place. And as soon as he heard the word hello, he started abusing, and he started saying that you have wasted my time, you have not come. So he just kept on firing. And then when he stopped talking, he realized that the friend was not answering. The friend's wife was answering the phone, and the wife said that your friend will come no more because he passed away in the middle of the night. So he's dead. So the man was devastated. He just dropped the phone and he sat down. And then after a few days, he realized that there is a ringing in his ear which has started. That is tinnitus, which had started. And so after that, he went from one doctor to another doctor. There is a long history which is written. He had taken different types of therapies, so much of medicine, some vibration therapy, different ear specialist he went. And for 6 months, that tinnitus did not go, and that went on happening again and again. Now, after trying so many doctors, and he became a very irritable. He was a very quiet person, very peaceful person. It is written that he would not even kill a fly. But instead of that, he became so irritable that even the wife was scared to go in front of him. So he became such an irritable personality. And then finally he went to a homeopath and he told that this is how this is happening to me, the tinnitus. So the homeopath, as usual, he inquired about the cause, and he found out that after listening to the news of the death of his friend, this has started. And so there was only one medicine in Materia Medica, that ringing at the ear by bad news, by some bad news. And gelsemium was the only medicine. And only one dose of gelsemium had cured this person. So see how in paucity, sometimes the ailments, the cause, if you reach to the cause, then it can be useful. So this is one case which I would like to just explain. I wanted to share with everyone. Okay, thank you.
Thank you, Dr. Heena. It was a wonderful presentation. Actually, while case taking, we all of were missing many of these points. We are not considering in this point of view. Actually, it's a great awareness for all of us, because while studying the organon, we don't go through this depth. You are an organon teacher, that's why you know more than more points about the organon. Now it is a time for the Malayalam session. Otherwise, I think every participants will have questions to ask to you. But I don't.
I'm so sorry, because organon teachers are like this; they can't stop. Once they
Madam,
Okay,
we
it's okay.
can,
Actually,
Madam, we can have another session.
yeah.
So
We will
that
have
you
another
can.
session. Actually, it is a wonderful. Everyone is listening keenly because everyone is making mistakes, and it's a very interesting also. Your
Thank you, thank you so
Thank
much.
you so
Thank
much
you.
on behalf of IFPH. And
Thank you.
now we are moving to the Malayalam session. I am inviting the moderator of Malayalam session to conduct the next session, please.